So I am Kalondrea Davis, and I am the Clinical Health Services Program Director for Harris County Public Health. I was diagnosed at the early age of 33, and I felt a lump doing my own self-exam, and I kind of thought in the back of my head, that's not nothing. I like to tell everyone I play a doctor on TV. So I said, oh, it's just young breast tissue. But something in the back of my head said, you should take this a little more serious. So I set up an appointment with my doctor. She performed a clinical breast exam and agreed that there was something there. From there, we went on to do more testing. We did some ultrasounds, we did a biopsy eventually, and I kind of knew in the back of my mind that it was breast cancer. No one knew at the time that I was being worked up but my husband. I'm one of those people who I don't want to stir the pot. I don't want everyone to overreact or to have panic attacks or cry, because people think the worst nowadays when you hear a cancer diagnosis. So I remember I was at work. I was actually in a meeting. I was the executive director at the time of a nonprofit, and my phone rings, and I said, oh God, it's the doctors. So I step out, I answer the phone. She said, hey, we'd like to set you up a meeting to come in. I said, okay. I said, you can't tell me? She said, nope, come on in. So we set up an appointment. I go in, and the doctor had a car accident and couldn't make it to my appointment. So we set up another meeting. Believe it or not, I actually had a car accident and couldn't make it to the meeting. So the third time around, she calls and she say, okay, third time's the charm. I said, you know what? I need to know. Just tell me. I don't need you to go into detail. I'm a big girl. I can handle it. And so she says, okay, you have breast cancer. I said, okay, I have breast cancer. Now what? So I am a very matter-of-fact type person. If you tell me there's a problem, I immediately want to put a plan together and attack it. So I hung up that phone and I literally walked back into my morning meeting. Just like that. Kept it to myself, walked back in the meeting, continued to go about the day. And when I got off work, I decided I'm going to get ice cream. Ice cream makes everything better. At least for me, it does. So I told my husband, and he said, okay, we were waiting to hear. This is what we were waiting. And, he begins to cry, and I'm like, there's no crying in baseball. Quit crying, So I say, we're going to create a plan, and we're going to beat it. And I did just that. I got a great team, a great support system. We put a good plan together, and once we knew exactly what type of cancer it was, we attacked it. So because of my background, I was one test away from becoming a licensed clinical social worker. I thought I wanted to open my own practice. I thought I wanted to help others, in their mental health journey. After you receive some news that you have breast cancer, the world kind of stops. It literally gets put on pause. So I had one good cry. And after that, I was like, that's it. No more crying, let's get it done. And my husband was my support system 100%, 120%. We lived about 5 hours away from all our family. So we were kind of in Southern California, and it was just myself, my husband, and our 2 kids. That was my support system. And so shortly after finding out, my best friend flew into town, spent the weekend with me. But I'm very systematic. So, I allowed myself that one day of emotions of, the what if, the worst that could happen. And after that, I pushed it out of my head and said, let's move forward. Let's beat it. The most significant challenge was the disruption in your everyday life. We're so used and we're so programmed to getting up, cooking, cleaning, the kids, the house, your bills, work. You're so used to putting everyone before you and making sure everyone else is okay. This was probably the first time in my life I had to worry about me. That was difficult. So my initial doctor and ultimately my oncologist was an African-American doctor and a female. I felt she heard everything I was saying. She heard everything I wasn't saying, and she was always a step ahead of me in where my mind would possibly go. That made it so much easier to navigate the system. Being from the healthcare world, I know how to advocate for myself. I know how to advocate for patients. But it was one of those things where it was okay to kind of step back and allow this team of experts to help me navigate the now healthcare system that I was traveling through. I had a total of 4 surgeries. One of them was a double mastectomy. And, I have this running joke with the family, oh, I look like Barbie now. But I still look cute in a bikini. So, that's kind of the running joke, but I was completely down. I couldn't do anything for myself. And my sister, I have 2 sister-in-laws, they flew into town and they cooked. They cooked and they froze things. They made sure my son, my daughter, even the dog, my husband, they made sure everyone was okay. Without them, without my best friend, without my husband, it definitely would have been difficult to navigate. So I had to allow myself that opportunity to receive the help, because I'm one of those, I got it, I can do it. But I really couldn't. They removed some lipnoids underneath my arms to make sure that it had not metastasized. From time to time, I'll still get pain. I'll still get some swelling in my arms. I try to do really good stretching. I try to stick to yoga, but those are some of the after effects. I am completely numb in my breast area, so I have to truly be careful when I'm around sharp objects or corners. I actually cut myself a couple of years back because I walked past something sharp and didn't feel it. And my son was like, you're bleeding. It's like, oh, okay. So, there are some lasting effects. I'll say my outlook on life, it completely changed. I thought my husband and I was gonna have a 3rd child. I decided not to. Worst case scenario, I get cancer somewhere else. I didn't want to leave my husband with kids to raise, So we decided not to have any more kids. And then I decided not to become a therapist, trying not to get emotional. So, I tried to do good and put good out and support others. But ultimately, life is precious. And I understand that just a little bit more. So I value the energy and the time I put into relationships so much more now. I think I am a great person, a good friend in any relationship, whether it's, being a daughter, a sister, a cousin, doesn't matter. So I live a very peaceful life, stress-free, real chilled. And if you can't come into my life and offer positivity, then I don't want the relationship. First things first, check your boobies. Check them, feel on them, understand what's normal, what's not normal, and don't second guess yourself. If you feel something, say something. Go see someone. If you're afraid, drag a friend with you, make them get a clinical breast exam. When you're diagnosed, the best thing you can do is figure out who in your circle is truly a support system. Not everyone will be a real support system. And you also have to speak up and let people know what you need, because some people feel helpless that you're helpless. So they don't know how to help you. So you have to speak up. You have to let your family, your friends know what you need. And you have to advocate for yourself throughout that journey, because you are your biggest cheerleader. Being the clinical health services program director, I have this unique opportunity to support and encourage, people in Harris County to take their sexual health serious, to take their mental health serious, and their physical health serious. Being a breast cancer survivor, I am always advocating and always encouraging people to do your self-exams. Come in to our clinic. If you don't know how to do it, one of our providers will teach you. If you're unsure what you're feeling for, we will help walk you through the process. We also help help with cervical exams, which can help detect early cancer as well. So we do a lot of great work for the Harris County community, and a lot of people may not be aware that we offer those services. So I encourage you, give us a call, jump on our website, come see us. We're here to support you in Harris County. It's always tough when you have to tell your family the news, right? My family is dramatic as hell. And so they all reacted horribly. I remember being on a family, Zoom meeting and saying, hey, I'm only gonna say this a couple of times. So I want to make sure everyone knows, but by that time I knew what the diagnosis was, I knew my plan of action, and I knew what we were going to do to fight it. And so I remember telling my family, and you would think that the world was coming to an end and everyone was so sad and so depressed. And so I had to work really hard not to have that counter transference from their worries and put them on me. So I had to work really, really hard in keeping this positive barrier up, because the positivity that I had, the mental state, I think it helped me through the process and treatments, because your mind is very powerful. And what you tell your mind to do, your body will react. And I believe wholeheartedly in that. So I tell people, have a positive mind, a positive spirit, and keep positive people around you.